Hi, everyone. My name is Dr. Scott Ramsay. I'm a nurse clinician in the Neurological Care Centre at BC Children's Hospital and an assistant professor in the School of Nursing at UBC. I want to thank you all for coming to my presentation today entitled Beyond the Ice Experience of a Former Pro Hockey Player and Learnings to Improve Concussion Care for Children and Youth. Before beginning my presentation, I just want to acknowledge that I'm presenting from the traditional, ancestral, and unceded territory of the Coast Salish people. For myself today, that's the Tsleil-Waututh Nation, for which I'm lucky enough to live. My presentation today is going to begin with an overview of my concussion story. Then I'm going to talk about pediatric concussion and why it's such a big deal. And then just finish off with some of my recent research on concussion among children and youth in BC. So beginning with my story, as was mentioned, I was fortunate to play 4 years in the Western Hockey League from 2007 to 2011 with the Chilliwack Bruins, Seattle Thunderbirds, and Massanutten Tigers. For those not familiar with the WHL, it's one of the top junior leagues in the world, feeding directly into the NHL. And the pinnacle of my career, as you can see in that middle photo, occurred when I got invited to Anaheim Ducks rookie camp as a freshly turned 19-year-old. Now, obviously, there's a lot of factors that go into playing professional hockey, but the chances at this point seems pretty high for myself. And then, unfortunately, I had a string of injuries, which were 3 concussions in 13 months. During this time, I returned to play too soon. So in 2010, I was not cleared once, but twice after my concussion with the Ducks while still having symptoms. And this ultimately led to my downfall. After my 3rd concussion, which I sustained in Medicine Hat, I would go on to experience 9 months of hell with post-concussion syndrome. During this time, I had the most fragmented care, even as an elite athlete. I remember specifically at one point being in the emergency room at Vancouver General Hospital with such an awful migraine, and the ER doctor looked at me and she said, "Sorry, there's nothing I can do for you." And ultimately, I made the decision at 19 years of age to retire from hockey and contact sports altogether. And it was this sequence of fragmented, mismanaged care by professionals who were supposed to have knowledge and look after me, or in some cases, they didn't have the resources to help, that have ultimately led to my passion for concussion care and research. And so now I just want to share a quick video.
Hi, I'm Scott Ramsay. I'm a former Western Hockey League defenseman. I played 4 years in the Western Hockey League. I'm currently a registered nurse at BC Children's Hospital. I suffered 3 concussions in about 13 months, approximately during my time in the Western Hockey League. These were all from various aspects of the game. My first one was during play. I slipped and fell. An opposing player's knee went to the back of my head. My head hit the boards and I blacked out. I woke up in the change room, not knowing where I was. My next one, I got in a fight. I slipped and fell on the ice, and the opposing player fell on top of me, crushing my head without a helmet on. And the last one, I was doing something very simple, just going to dump a puck in, and I wasn't paying attention. An opposing player came off the opposite bench and elbowed me right in the jaw. My head snapped back just like this, and I actually played the rest of the game. But as the game progressed, I got a headache that got worse and worse and worse. And actually, after the game, one of my teammates who was sitting beside me said, he goes, you don't seem okay. Are you all right? You just seem off. There's something wrong with you. You should probably go talk to the trainer and let him know. And so I took his advice and I went and I talked to the trainer. I got further assessed, and I actually got diagnosed with my 3rd concussion in approximately 13 months. And it was actually this doctor who I saw for my last concussion, and he actually advised me that I probably shouldn't play contact sports and to think about other things that I want to do in my life. That I had a long life ahead of me, and I had suffered so many concussions in such a short period of time. At the time, they didn't really know a lot about the cumulative effects of concussion, which obviously is a little bit different now, but clearly still evolving. And he was definitely the person who influenced me the most to really think about my life after hockey. It was kind of in that time period afterwards, I had post-concussion syndrome for approximately 9 months. And the biggest thing that I experienced during that time, stepping away from hockey and recovering from all my concussions, was my mental health. There was one point where my mom said to me, "If you weren't my own son, I wouldn't know who you are." I had mood swings. I couldn't sleep. I was super depressed. I would sit in a room all day with glasses on and just not want to talk to anyone. I don't think this is very common knowledge. I think there's a huge misconception, especially with concussion in general, because you can't physically see it. You only get to experience the physical symptoms yourself, but there are definitely mental health symptoms, as I described earlier, that are present and need to be recognized too. I think the biggest thing that helped me was to speak to people. I definitely feel the more and more people I talk to, the more informed I became and could make an informed decision for myself, whether that was with my family members, friends, coaches, teammates, or healthcare professionals. It didn't really matter. The more and more I talked to people, the more I came to the realization what was actually going on with me was not okay. And I need to look after myself and my own health, because ultimately you can see that there's more to life after sport.
So that video was filmed as part of the concussion awareness training tool led by Dr. Shalina Balbul out of the BC Injury Research and Prevention Unit. And she's actually speaking later today, so I highly encourage you to go listen to her. Obviously, this video is a few years old now. I have a few more gray hairs. But reflecting on watching the video, the one thing that just stands out to me is just how important my parents were, my friends, and people who genuinely cared about me. They really made a difference in helping me through my concussions and my post-concussion syndrome. And if it weren't for them, I honestly do not know where I'd be. And so after retiring from hockey in 2011, I began my journey in education, getting my Bachelor's of Science in Nursing, and recently my PhD last year. Currently, as I mentioned, I'm a nurse clinician in Neurological Care Centre at BC Children's and assistant professor in the School of Nursing at UBC. Okay, just transitioning now over into pediatric concussion. So I'm sure everyone knows this definition by now, but I will just repeat it. So a concussion is defined as a type of traumatic brain injury induced by external forces resulting in an alteration in brain function. This would include being struck with an object, striking a hard object, your brain undergoing an acceleration, deceleration movement, or an explosion. And so the example that I always give to illustrate the differences is a child who trips and falls hitting their head on the soccer pitch and a child who falls directly out of a tree. Both may sustain a concussion. Next, National Injury Surveillance in Canada estimated 46,000 cases of pediatric concussion were diagnosed in 2016-2017. However, we know this figure is most likely an underestimation due to a number of factors, including underreporting. And so why is this important? Well, concussions are a significant health issue for children and youth with the potential for long-term consequences in multiple domains of health. And it is the chronicity and potential sequelae of concussion that pose the greatest threat to children's health and well-being. So a concussion can result in a complex set of symptoms that affect physical, cognitive, emotional, and sleep-related domains. Each case of concussion will have a differing presentation dependent upon multiple factors. Some commonly reported symptoms of pediatric concussion in decreasing order of severity reported by Canadian youth at 28 days post-injury were difficulty concentrating, irritability, difficulty remembering, headache, confusion, fatigue, and drowsiness. Now, the signs and symptoms of a concussion can appear immediately or subtly, potentially taking up to days to materialize after injury. And so this is why an evaluation of history, assessment of symptoms, cognitive and cranial nerve function, and balance is essential given the variation in individual presentation of pediatric concussion. And I can't tell you how often I've heard someone tell me that they did not start experiencing symptoms until 2 or 3 days after they hit their head. And this, to me, really raises the important point of listening to your children. As a pediatric nurse, I'll tell you that kids are really good historians, and some are even better than their parents for that matter. So if you stop and take the time to listen to what a child is actually telling you, it's important to take that information seriously and act upon it. Lastly, making a diagnosis of concussion in children and youth, especially younger children, can be challenging due to the variability in clinical presentation of concussion in this population. And so, unfortunately, what we often see in the clinic is that clinicians, prior to coming to see us, they don't have a thorough understanding of what a concussion looks like in younger children. And just finishing off on the symptomology piece, I just want to highlight that the total symptom scores and most individual symptom scores decrease over time for children and youth. And what this means is that eventually you will get better. I think that it's an important piece that is not stated enough. Symptoms will dissipate and you will get your life back. However, it's different for everyone. And so what we've seen is the consensus group has reflected that the consensus group in sport, they've just recently increased the recovery time for pediatric concussion up to 28 days. However, the literature indicates that it's clearly beginning to become prolonged, sometimes as long as 3 months. And so I think it's time to begin to start normalizing that timeline. Remember that a concussion is a traumatic brain injury and not just a bump on the head. The next point to address, which is specific to pediatric concussion, is returning to school or learning. So cognitive difficulties experienced by the pediatric population include symptoms such as difficulty with concentration and remembering. And so there's been a correlation between cognitive activity and prolonged symptom resolution. So these difficulties may exacerbate some of the challenges faced by children recovering from concussion when they return to the classroom. This highlights the need to support children in the classroom with academic accommodations upon their return to learn. And then lastly, Dr. Molly Cairncross and colleagues published what I think is a really important study on screen time and technology that I'm not sure a lot of people know about. So in this study, the authors found that concussed children with low and high screen time were both associated with relatively more severe symptoms in the concussion group compared to the orthopedic injury group. So what this highlights is that moderation in screen time may actually be the best approach to clinical management. Okay, and now just finishing off with some of my research. So my doctoral research built upon my clinical nursing background as a nurse clinician, my experience as a brain injury survivor and high-level athlete, my multiple research assistantships, and my doctoral training at UBC. It's important for me to acknowledge that the combination of these individual experiences molded together provided a unique perspective for my research to be situated in. And so I just need to share a quick disclaimer before presenting my research, as is through the British Columbia Ministry of Health. So access to the data provided by the data stewards is subject to approval, but can be requested for research projects through the data stewards or their designated service providers. All inferences, opinions, and conclusions drawn in this presentation are those of the author and do not reflect the opinions or policies of the data stewards. So after a concussion is sustained, it's important to have a follow-up visit. Follow-up visits are important for reassessing an individual, managing symptoms, and providing education. In my doctoral research, the emphasis was on the first follow-up visit. This focus was guided by my clinical practice, where I saw numerous patients presenting for follow-up months after their initial diagnosis. And so from a Canadian context, post-concussion care guidelines created by the Ontario Neurotrauma Foundation specified that a first follow-up visit for concussion should occur by 4 weeks. This is one of a handful of guidelines that outlines the coordination of post-concussion care and really serves as a benchmark on how to improve current levels of care and service. And so the first publication that came from my dissertation was a review of follow-up visits after a concussion and the factors associated with the follow-up in the pediatric population. Overall, there was a wide range in the rate of follow-up visits, varying from 13% to almost 100% in studies. Both of those just happened to be Canadian studies too. There was limited information of follow-up visits after concussion in the pediatric population. These included varying follow-up periods in studies or studies that did not measure the time to first follow-up visit. In terms of factors that were related to follow-up visits of children and youth with a concussion, the studies identified injury-related factors such as the injury mechanism, individual factors such as age, and health service factors such as following up with both a specialist and a primary care provider. Although the literature indicates multiple factors may be associated with follow-up after concussion, the studies were not comprehensive, which led to mixed evidence. And so the second publication that's come out is just this abstract of the results to determine how many children and youth in BC with concussion receive a timely follow-up visit and the factors associated with timing of the first follow-up visit. So after I completed the linkage and data cleaning, I identified a total of 22,601 children and youth, 5 to 18 years of age, being diagnosed with a concussion that met the case definition between January 2016 and December 2017. One point that I think is worth noting is that the 22,601 cases in this study are the highest number of children and youth identified with a concussion diagnosis over a 2-year calendar period in BC specifically. And so here I explored how many children and youth in BC with concussion receive a timely follow-up visit. Of the 22,601 cases identified initially, 19% received a timely follow-up visit, 4.9% had delayed follow-up, and 76.1% received no follow-up at all. The median number of days to a first follow-up visit was 9 for the entire study period. And so in that second research objective, I identified individual and health service factors that were associated with timing of the first follow-up visit post-concussion. And so this objective was addressed by running binary logistic regression. Rather than boring you with the tables of that, I'm going to show you the factors. So the factors that were associated with a timely follow-up visit included being a youth, living in a rural geographic area, while having average income or lower, and seeing either a general practitioner or emergency physician at initial concussion diagnosis were negatively correlated with timely follow-up. So just to review some key takeaways from my chat today. So first, there are a variety of ways to sustain a concussion. The symptomology in pediatric concussion is broad, and there's a range in the duration of symptoms. Next, follow-up visit rates are low for concussed children and youth. Specifically in BC, we saw that less than 25% had any type of follow-up visit at all. And then lastly, multiple factors are associated with a timely first follow-up visit, and these factors should be considered at the initial diagnosis to ensure that timely follow-up occurs. So that concludes my presentation, and I am happy to take any questions. There's also my contact information. More than happy to chat via email or on Twitter. Thanks so much.
And I'm just going to jump right in, Scott. I've talked before, but I hear your story and I think of, you're a young man, you're living your dream, playing hockey. You had the support of your family, your support network. So what played into your decision to retire, to actually step away?
Mm-hmm. I had mentioned in the video that there was one physician that I talked to that I should seriously consider. And that was like the beginning of my process. But basically over the course of my post-concussion syndrome, I saw 10 different healthcare professionals who specialize in concussion. And 5 told me that I should retire, and 5 told me that, I didn't have to. It was really up to me. And so what ultimately led me to decide to retire is I spoke to someone who was a professor at the university where I did my BSN. And he just presented all the facts to me. He presented all the evidence that, having multiple concussions in a short period of time and multiple concussions overall there's decreases in brain function that I had. I'd played 4 years in the Western Hockey League. I'd accrued a scholarship. I could go and get my education, and that I had my whole life in front of me, and that I would eventually get better, even though what I was experiencing right now was, like I said, hell. And so, taking all those factors into consideration, um, I can sit here and say in retrospect it was an easy decision, but at the time it wasn't, to give up something that was really my first love and that I'd done for, almost 2 decades. So um, I think when we hear more stories like this, it can validate a lot of what people are going through, and it doesn't make their decisions any easier, but it might help them along the way.
Fair enough. Well, we have a couple of questions coming in. First of all, you're getting thanked for your presentation. And based on your research, who do you recommend as the most appropriate first point of contact for concussed youth, i.e., like the GP, emergency room, sport med doc, in order to raise the overall efficiency? Who would you recommend for first contact, and hopefully will be available for a follow-up visit?
Yeah, so two parts to that. So first off, if there's any red flags, so we know our red flags are um, seizure, posturing, um, blown pupils, um, uh, and so if you have any sorts of red flags, projectile vomiting multiple times, you should be going to the emergency room to be assessed by an emergency room physician at that point. If your symptoms are on the more mild side, I'm saying, headache, some dizziness, and you can tolerate and make an appointment to see your general practitioner, or in the pediatric population, your pediatrician. That's a great first place to go and get assessed. Um, I'll say as a nurse, we don't want, if you're not acutely ill, we don't want you to be cramming the ER room with something that can be assessed by a GP or a pediatrician. So that would be the first point of contact where I would recommend people to go.
Great. And we have a couple of questions regarding what is considered to be moderation in screen time for children. And is it not contraindicated during the recovery process?
Yeah. So this is why I love to bring up this study, because I think it's such a great study, especially with kids and technology, right? It's so relevant nowadays. And so the thinking used to be to have no screen time at all. And so what the study found is actually by removing screen time that they actually had worse symptom outcome. So that's why we say in moderation. And so it's that Goldilocks rule of not too much, not too little, right? Is where we find it sits best. And so with that, it's in moderation is it's best served. You don't want to exacerbate your symptoms. Like obviously you're going to have a background of a symptom profile. You might have a headache, but what you don't want to be doing is on your phone for 10 hours a day, making your symptoms worse. It's okay to be on your phone. We want to normalize your life as much as possible during recovery. We don't want to absolutely remove all your, like, especially for kids, their phone is their social network. We don't want to remove that during their recovery.
Great. We're getting some great questions here. One in particular, thanking you for your talk. And they're an athletic therapist with a team in the QMJHL, which I think this is interesting for you as a former player. Do you have any tips on how we can get better buy-in or honesty of players in the heat of the moment?
That's a great question. And I'll tell you from my personal experience, I used to have teammates that used to sandbag their impact test all the time. That way, when they got concussed, they could return to play sooner, even while they had symptoms, which is horrific. I think the biggest thing that makes an impact is just by doing education, and not just doing education at the beginning of the year, doing a midpoint education, doing education at the end of the season, right? I also think having people come in and share their stories and lived experiences is super pertinent to these situations as well. Um, and like I said in my video there, it was my teammate who recognized that something was not okay with me and convinced me to go and talk to the trainer. So by I think education is obviously the first and foremost, but I think that what we need to have is, in my opinion, is a level of policy change too. around education, requirements for reporting, and I would even go as far as saying is like fighting in junior hockey. So,
Here's a
which is
quick
a
one.
whole can of worms to open up.
Fair enough. Here's a quick one for you. Is baseline testing still being recommended for children?
No, no. Parachute has a guideline recommendation. I highly encourage you to check that out. That we don't need to baseline test our children before their sports season.
Okay, we have enough time for one or two more questions. So another one up. How do you see your research translating to improvements in ER at children's hospitals for concussion management? There seems to be vast inconsistency in training and knowledge of ER staff on the diagnosis, treatment, and recommendations for follow-up care. All of this needs to be addressed.
Yeah, I completely agree with that. Um, I bridged into my PhD, so I didn't quite finish my master's, but in my master's, I was looking at this topic because I found when I worked in the emergency room that the physicians and nurse practitioners, they didn't use the same guidelines or protocols. And so one would say something different than the other, and some of them contradicted themselves. And so I think, in my personal opinion, there needs to be a level of provincial policy. I think if we have provincial policy at that level, it will help standardize, and that way everyone can be on the same page as to like what the actual protocols and procedures are for having someone with a concussion diagnosed, their referral for management, and then further on referral for any specialized care.
Okay, and another one for you regarding UBC, Children's Hospital. Do you have any programs at the Children's Hospital for after initial diagnosis to then refer out to other concussion literate providers like a physio, OT, who can follow up and provide appropriate rehab, as it can be a challenge to follow up with GPs and ER docs?
Yes, yes, it can, and I know that firsthand. Um, So the simple answer is no, we do not have any programs at BC Children's Hospital, um, which I am trying to rectify. But there's many variables to take into account with doing that. We do have programs dependent upon where you live and your age. So we have GF Strong, which covers Vancouver Coastal Health Authority. People in BC will know that for children above the age of, I believe it's 12. And then in Fraser Health, we have, I believe, a concussion clinic for youth above 14 or 16. And so there are a couple resources in the different health authorities, but provincially there is no center at Children's in terms of that. At the Neurological Care Centre, we will take a referral for what the neurologists consider a complex concussion, which would fall under the criteria of having neurological symptoms that persist for beyond a month.
Okay, and then here's one that goes a little in a different direction. How do you see the information being translated to all primary and high schools?
Yes, thank you for asking that question. So, we've heard throughout the day today, I believe it was the minister earlier this morning was talking about, it's the families and children that need to be informed, right? So what I find too often happens is these families get told something and then they think things will be taken care of for them, or they don't give them the proper education. And so all of a sudden, 1 month passes, 2 months passes, they are having an exacerbation in their symptoms, and the next thing you know, they have persistent concussion syndrome, and it's like 4, 5, 6 months later. So if we take a level of prevention and go up the river rather than trying to fix the problem down and give these children information in schools, I personally think that physical education class is the perfect place to do a concussion module, and you learn it early and are reassessed on it each year as you go through primary school and into secondary school. I think when we think about levels of prevention and where the best roads to make ingresses in, I think the educational system is, to me, a logical step.
Okay, and so with regards to that, what are the next steps for your research?
So as a nurse, one of the big things that I'm trying to look at is building off my doctoral research is just around, we've heard it today, getting access to primary care GPs, services, someone with specialized care. So what I'm hoping to do is pilot an intervention looking at nurse-led follow-up of concussion through BC Children's. Also, looking at knowledge translation and education, working with Dr. Shalina Babul, who was on my committee, doing lots of work around that, and then kind of building on that further and looking. We have some clinics here. They're called the Foundry, where lots of patients with mental health present who have concussions. And so doing some work with those clinics and those care providers just around healthcare professionals that see lots of concussions that may not have the same level of knowledge as someone who works in like an emergency department at BC Children's.
Okay, and then you spoke about concussion underreporting, and we were wondering from your experiences, are there opportunities to improve on that reporting?
Yes. So anyone who knows me will know that I'm super passionate how I think we do such a disservice that there's only Rowan's Law in BC or in Ontario. And as someone who's in BC who doesn't have a publicly funded pediatric concussion clinic, there's no provincial policy or legislation. And even go like a step further, and that there's no federal legislation. And I think those are all when we think about prevention and care and places where we can have significant impact for reporting, for education, for clinical care. Those are very logical steps for me. But as we all know, politics plays a large role in that. And so getting our going to your MLA, going to your MP, and just being a voice and saying this is an issue in our community. Look at the research. I can't tell you, I had a meeting yesterday with one of our health authorities, and they told me that concussion's not one of their priorities. And so it's getting to politicians and health leaders and making them realize that this actually is an issue in our community, and it's just not being reported for multiple reasons. Education, lack of access to care are just a few that pop to mind.
Okay, and another question from the audience. How would you recommend determining full recovery, return to play in kids, since we do a baseline on adults to know when they have returned to percussion function, but without that with kids, what would be the best way in your opinion?
So there's the return to play protocol, the steps. You have to follow the steps. I coach youth hockey, have for over a decade. BC Hockey has a really sound, thorough protocol as to the steps we have to follow to get them cleared. Within that, they do neuropsychological testing that has to meet normative values. There has to be symptom resolution, and they have to meet all the steps of the return to play protocol. And so between those three areas, that's how we clear someone to return to play.
Well, that's awesome, Scott. Thank you so much for taking your time to present. That was a lot of great information. And I'm now going to throw it back to the SIRC team in the studio in Ottawa.
Thanks, Paula. Good seeing you.
You too. Cheers. Bye.